Greetings, future nurses. Nurse Ed Scholar here. Today we're going to explore the cranial nerves. These are the vital messengers connecting the brain to various parts of the body. So we're going to decode the secrets of each cranial nerve and master, this art of assessment. So let's dive in. Now, we're going to start off going through cranial nerves 1 through 8. So our journey begins with the olfactory nerve, that's cranial nerve 1. It tests the sense of smell. Um, so how would you assess this? So you'd have the patient close their eyes, and then you'll have them try to identify something familiar, some kind of odor that's familiar, that's not really, irritating. So like coffee or even peppermints, even soap. Okay. And then you will go on to optic nerve, which is cranial nerve 2. It's responsible for vision. And so this is a sensory nerve as well. And you can assess visual acuity with a Snellen chart. And you'll be familiarized with this while, in your studies in school. So when we're looking at cranial nerve 3, 4, and 6, the ocular motor, which controls pupillary constriction, upper eyelid, elevation, and eye movement. The abducens nerve, um, which controls lateral eye movement, and the trochlear nerve, which controls downward and inward eye movement. So these three together kind of govern the eye movement. So they overlap to test the motor function in the eye. Okay. Um, then we'll have the trigeminal nerve, cranial nerve 5. It's a sensory and motor nerve. It controls sensation in the cornea. Okay, now this will be done by the primary care doctor, which a lot of the times they'll do it by taking like a piece of a cotton swab and kind of placing it on that cornea, and see if they blink. But we don't do that, but we still have to know it. So, trigeminal nerve, cranial nerve 5, it controls sensation in the cornea, nasal or oral mucosa, facial or skin. So like you can kind of palpate the skin with their eyes closed, and seeing, where, having them identify where you're touching, um, the skin on the face. Um, the trigeminal nerve also controls, they call it mastication, but basically that's chewing. Um, and uh, and so with that, you'll have the patient um, kind of clench their teeth. Okay. The facial nerve, cranial nerve 7, is also a sensory and motor nerve. Um, it controls movement of the face and taste sensations. So with taste sensation, you would see if the patient can distinguish between salty and sweet. Um, the acoustic or vestibule cochlear um, nerve, cranial nerve 8, it controls hearing and vestibular function. So basically hearing and your equilibrium on your patient. So what we'll do is may do some acuity tests. We may look at their balance. We may use the Weber's test or the Rhines test to look for sensorineural hearing loss. So, that's what you would do for cranial nerve number 8. And so moving on to cranial nerve 9 through 12, you'll have the glossopharyngeal nerve. So that's cranial nerve 9. And in conjunction, you'll have the vagus nerve, cranial nerve 10. So these two together control swallowing, taste perception, and sensations. But specifically, the glossopharyngeal nerve controls swallowing ability and taste perception, and cranial nerve 10, the vagus nerve, also controls swallowing and phonation sensation. Now, moving on to cranial nerve 11, the spinal accessory nerve, it controls neck and motor muscle strength. So, what we would do is kind of, palpate the sternocleidomastoid and trapezius muscles. But basically, what we would be doing is putting our hands on the patient's shoulders and having them to shrug, against resistance of our hands and seeing, do they have muscle strength. And then also for the neck, what you could do is place your hand on their cheek and have them push against the hand. And then you would move it to the other side of the cheek and have them push in that direction against the resistance of your hand to check the neck muscles. And then finally, we have the hypoglossal nerve. Um, it orchestrates tongue movements and speech and swallowing. And so, how you would test this nerve is that you would just ask the client to stick out their tongue, take it out, and move it side to side. Okay. So with that, that was a quick overview of the cranial nerves. So, congratulations. You can always come back to this video and just kind of look at the slides and kind of commit it to memory. Um, but just kind of giving you the nuggets that you need to study. So, understand that learning the cranial nerves is important in your clinical practice. We have to know how to assess our patients uh, uh, adequately. And during our assessments, we have to make sure that we take note of any kind of asymmetries, any deviations from the normal, any subtle signs, during our exam to note, hey, something is possibly uh, going on with our patient. And so mastering the cranial nerve assessment is a real powerful tool, as a nurse in ensuring, comprehensive patient physical health and well-being. So with that, I just want y'all to keep exploring, keep learning, and stay tuned for some more nursing insights. And until next time.